ChatGPT on defunct medical treatments. Can you provide me a list of defunct medical practices or treatments? Sure. Here is a list of some defunct medical practices or treatments: bloodletting, trepanation, leech therapy, cupping, mercurialism, hydrotherapy, lobotomy, radium therapy, pneumothorax, sexual reassignment surgery, conversion therapy, icepick lobotomy, Dr. William Beaumont's stomach experiments, humorous therapy, fever therapy. Note, these treatments were once thought to be effective but have been discredited over time due to lack of scientific evidence or have been replaced by better treatments. Speaking of bloodletting and leech therapy, why was it practiced for such a long time? Bloodletting and leech therapy were practiced for such a long time because they were based on the ancient Greek concept of the four humors theory of medicine, which stated that good health was dependent on a balance of four fluids or humors in the body: blood, phlegm, yellow bile, and black bile. Illness was thought to be caused by an excess or deficiency of one or more of these humors, and bloodletting was seen as a way to restore balance. Additionally, in the case of leech therapy, the use of leeches was believed to remove bad blood from the body and was commonly used for a variety of ailments, including headaches, fever, and skin infections. Despite its widespread use, bloodletting was later shown to be largely ineffective and sometimes even harmful, leading to its eventual abandonment as a medical practice. Leech therapy, on the other hand, has been revived in recent years as a treatment for certain medical conditions, such as plastic and reconstructive surgery, due to the anticoagulant and anti-inflammatory properties of leech saliva. Perhaps bloodletting lasted so long because it has a noticeable physiological effect that supports a powerful placebo effect. What kinds of experiences do people recount? Yes, that's a possibility. The placebo effect, where a person's symptoms improve simply because they believe they are receiving treatment, can be quite powerful. In the case of bloodletting, people who underwent the procedure might have felt a sense of relief due to the release of endorphins, which are natural painkillers produced by the body. Additionally, some people might have felt that the procedure helped to relieve stress or anxiety, since it was seen as a way to purge the body of negativity. People who underwent bloodletting also sometimes reported feeling lightheaded or faint, which could have been interpreted as a sign that the procedure was working. Additionally, bloodletting was often performed in conjunction with other treatments, such as herbal remedies or purgatives, which might have also contributed to a person's perceived improvement. Overall, the widespread use of bloodletting for such a long time suggests that the procedure did have a noticeable physiological effect. But it's difficult to separate the physiological effects from the psychological effects of the procedure, as both likely played a role in its continued use. Doesn't cupping therapy often work better than deep tissue massage for the same purposes as deep tissue massage? Cupping therapy and deep tissue massage are both used to alleviate pain and tension in the muscles and tissues, but their effectiveness can vary depending on the individual and their specific condition. Studies have shown that cupping therapy can be effective for reducing muscle pain and stiffness, improving circulation, and promoting relaxation. However, other studies have shown that the benefits of cupping therapy are not necessarily greater than those of deep tissue massage, and the evidence is still limited. Deep tissue massage, on the other hand, has been shown to be effective for a wider range of conditions, including chronic pain, fibromyalgia, and sports injuries, among others. This is likely due to the massage therapist's ability to directly apply pressure and manipulate the affected muscles and tissues, which can help to break up adhesions and knots, improve range of motion, and promote healing. Ultimately, the choice between cupping therapy and deep tissue massage will depend on the individual's needs and preferences, and both techniques have the potential to be beneficial. It's also worth noting that both cupping therapy and deep tissue massage can have side effects and can be uncomfortable. So it's important to discuss the risks and benefits with a healthcare provider before starting treatment. Bloodletting is also an underground harm reduction practice today to prevent left ventricular hypertrophy from dangerously high hematocrit levels among active steroid users who are not allowed to donate blood. Yes, you are correct. Bloodletting as a harm reduction practice is still used today, although it is not widely recognized or endorsed by mainstream medical organizations. In the context of active steroid use, bloodletting can help to reduce the risk of left ventricular hypertrophy (LVH), which is a condition where the heart muscle becomes thickened and stiff, and can lead to heart failure. This is because high hematocrit levels, which can result from steroid use, can increase the risk of LVH. Bloodletting in this context typically involves removing a small amount of blood with the goal of reducing the hematocrit level to a safer range. This practice is typically done underground, as it is not widely accepted or regulated, and there are concerns about the safety and efficacy of this approach. It is important to note that this form of bloodletting is not recommended as a harm reduction strategy, as it can be dangerous and can expose the person to the risk of infection and other complications. Instead, individuals who are concerned about the effects of steroid use on their health should consult with a healthcare provider and consider alternative approaches, such as reducing their steroid use or seeking alternative forms of treatment. Tell me about fever therapy. Don't fevers have natural beneficial functions as long as they don't get too high? Fever is a natural response of the body to fight infections and other illnesses. When a person has a fever, their body temperature rises as a way to create an environment that is less hospitable to invading pathogens. This helps to stimulate the immune system and enhance its ability to fight off the infection. However, fevers can also be dangerous if they become too high, as this can lead to dehydration, heat exhaustion, and other complications. It's important to monitor a fever and seek medical treatment if the fever becomes very high or lasts for an extended period of time. Fever therapy, also known as pyrototherapy, is the practice of intentionally inducing a fever for the purpose of treating certain medical conditions. This was a common practice in the past and was used to treat a variety of conditions, including tuberculosis, cancer, and mental illness, among others. However, the use of fever therapy has largely been discredited by modern medicine as there is limited evidence to support its effectiveness, and it can be dangerous if not carefully monitored. Instead, fevers are typically treated with medications, such as antipyretics, that can help to reduce the fever and prevent potential complications. In summary, while fevers can have natural beneficial functions, it's important to monitor them and seek medical treatment if necessary. Fever therapy is not recommended as a treatment option, as it is not supported by evidence and can be dangerous. How is it that sexual reassignment therapy is defunct? Sexual reassignment therapy, also known as gender reassignment therapy or gender affirmation therapy, is a form of therapy that was once used to treat individuals with gender dysphoria, a condition where a person experiences significant distress due to a mismatch between their biological sex and gender identity. In the past, sexual reassignment therapy often involved long-term psychotherapy, hormone therapy, and sometimes surgeries to alter the person's physical appearance to align with their gender identity. However, over the years, medical and scientific understanding of gender identity has evolved, and the use of sexual reassignment therapy as a treatment for gender dysphoria has been largely discredited. Instead, the current medical consensus is that gender dysphoria is a condition that can best be treated by supporting the individual in their gender identity, rather than trying to change it through therapy or medical intervention. This shift in understanding has led to a change in the approach to treating gender dysphoria, with a focus on gender-affirming care, which includes hormone therapy and surgeries, if desired, as well as psychological support. In short, sexual reassignment therapy is considered defunct because it is no longer considered an effective or appropriate treatment for gender dysphoria, and has been replaced by gender-affirming care that better reflects the current understanding of gender identity. And what is the difference between gender-affirming hormone and surgeries on the one hand and sexual reassignment therapy on the other? Gender-affirming hormone therapy and surgeries are medical interventions that are used to help individuals who experience gender dysphoria align their physical appearance with their gender identity. Hormone therapy involves taking hormones, such as testosterone or estrogen, to help bring the body into alignment with the individual's gender identity. Surgeries can include procedures such as chest surgery, genital reconstruction, and facial feminization surgery, among others. In contrast, sexual reassignment therapy is a form of therapy that was once used to treat individuals with gender dysphoria, and often involved long-term psychotherapy and medical intervention, such as hormone therapy and surgeries. The focus of sexual reassignment therapy was often on changing the individual's gender identity to align with their biological sex, rather than supporting their gender identity. The current medical consensus is that gender-affirming care, including hormone therapy and surgeries, is a more effective and appropriate treatment for individuals with gender dysphoria, as it is based on the understanding that gender identity is a deeply held and innate aspect of a person's identity. In contrast, sexual reassignment therapy is considered defunct, as it is no longer considered an effective or appropriate treatment for gender dysphoria. How is it that such an invasive procedure as lobotomy became so popular? Lobotomy, also known as leucotomy, was a surgical procedure that was developed in the early 20th century as a way to treat individuals with severe mental illness, such as schizophrenia, depression, and mania. The procedure involved cutting or destroying nerve fibers in the brain to change the patient's behavior and mental state. Lobotomy became popular in the mid-20th century, in part due to the lack of effective treatments for severe mental illness at the time. The procedure was marketed as a quick and effective solution for individuals who were considered to be severely disabled by their mental illness. Additionally, lobotomy was seen as a less intrusive alternative to traditional forms of institutionalization and restraint, which were often used to manage individuals with severe mental illness. The procedure was seen as a humane way to help individuals who were struggling with mental illness, and many mental health professionals and patients' families viewed it as a last resort. However, the popularity of lobotomy was short-lived, as it became clear that the procedure often resulted in significant and permanent brain damage, and did not provide long-term benefits for many patients. In addition, the development of new and more effective forms of psychiatric medication and psychotherapy led to a decline in the use of lobotomy. In conclusion, lobotomy became popular due to a lack of effective treatments for severe mental illness and the perception that it was a humane solution for individuals with mental health challenges. However, its popularity was short-lived as it became clear that the procedure resulted in significant harm, and it has since been discredited as an appropriate treatment for mental illness. Can you explain radium therapy and mercurialism, why these became popular, and the events that led to them being defunct? Radium therapy was a form of medical treatment that involved the use of radioactive radium to treat a variety of conditions, including cancer, arthritis, and skin conditions. The procedure involved exposing the patient to a concentrated dose of radium, which was thought to have therapeutic properties due to its radioactivity. Radium therapy became popular in the early 20th century due to a growing belief in the therapeutic properties of radioactivity and the lack of effective treatments for many medical conditions. At the time, the dangers of radiation exposure were not well understood, and radium was seen as a miracle cure for a variety of ailments. However, it soon became clear that the use of radium was causing serious health problems, including radiation poisoning and an increased risk of cancer. In addition, the development of new and more effective forms of medical treatment, such as chemotherapy and radiation therapy, led to a decline in the use of radium therapy. Mercurialism, also known as mercury poisoning, was a condition that resulted from exposure to mercury, a toxic heavy metal. In the past, mercury was used as a treatment for a variety of conditions, including syphilis, and was also used in the production of hat-making and felt-making materials. Mercurialism became a widespread health problem in the 19th and early 20th centuries as workers who were exposed to mercury in these industries developed serious health problems, including neurological damage and other symptoms of mercury poisoning. Despite growing concerns about the dangers of mercury exposure, it continued to be used in various industries, and the use of mercury in medical treatments also persisted. However, as knowledge of the dangers of mercury exposure grew, the use of mercury in medical treatments and various industries declined, and regulations were put in place to limit exposure to mercury in the workplace. Today, mercury exposure is recognized as a serious health hazard, and measures are in place to protect workers and the general public from its toxic effects. In conclusion, both radium therapy and mercurialism became popular due to a lack of understanding of the dangers of exposure to radioactive materials and toxic heavy metals, respectively. However, as the dangers of exposure became clear and more effective forms of medical treatment were developed, these practices became defunct, and measures were put in place to limit exposure to these hazardous substances. Are Dr. William Beaumont's stomach experiments, which lead to scientific discoveries, defunct because they are unethical? And what are some perspectives around trepanation, such as ancient skull fractures or people like Amanda Fielding? Dr. William Beaumont's stomach experiments, which involve studying the digestive process by keeping an open wound in a patient's stomach, are considered unethical by contemporary standards of medical research and treatment. The experiments, which were conducted in the early 19th century, involved exposing a patient's digestive system and exposing him to various substances to observe the digestive process. The experiments have been criticized for the lack of informed consent and the ethical implications of exposing a patient to potentially harmful substances and procedures for the purpose of scientific experimentation. In terms of trepanation, it is the surgical procedure of drilling a hole in the skull, which was once performed for a variety of reasons, including the treatment of various medical conditions, as well as for religious and cultural reasons. In modern times, trepanation is considered a controversial and largely discredited medical practice and is not performed as a routine medical treatment. However, some individuals, such as Amanda Fielding, advocate for trepanation as a form of alternative medicine, claiming that it can improve brain function and increase awareness. These claims are not supported by scientific evidence, and the procedure is considered risky and potentially harmful. In conclusion, while some practices, such as Dr. William Beaumont's stomach experiments and trepanation, were once considered acceptable or even desirable, they are now widely considered unethical or discredited due to a greater understanding of the dangers and risks associated with these procedures. Considering these defunct medical practices and despite scientific developments, it is likely that some particularly well-accepted medical practices today will become defunct in the future. What can you suggest about that? It's true that some medical practices that are widely accepted today could become defunct in the future, as our understanding of health and medicine continues to evolve. Here are some factors that could contribute to this process. Advances in technology. The development of new technologies and techniques may make certain medical practices obsolete. For example, the development of newer and more effective surgical procedures has led to the decline in popularity of older procedures. Changes in medical understanding. As our understanding of the human body and diseases improves, certain medical practices may become seen as outdated or ineffective. Evidence-based medicine. The shift towards evidence-based medicine has led to a greater emphasis on scientific research and data in the development and implementation of medical treatments. This has led to the rejection of some medical practices that are not supported by scientific evidence. Ethical considerations. Medical practices may become defunct if they are seen as unethical or harmful. For example, the use of human subjects in medical experiments without their informed consent has been widely condemned and is no longer acceptable. Social and cultural factors. Social and cultural factors can also play a role in determining which medical practices become accepted or rejected. For example, changes in attitudes towards certain treatments or conditions can lead to changes in the medical practices used to treat them. It's impossible to predict with certainty which medical practices will become defunct in the future. But ongoing advancements in medical research and technology will likely continue to shape our understanding of health and medicine. What can we learn about psychology and benevolent community from these defunct medical practices? The history of defunct medical practices provides important lessons for psychology and the benevolent community in several ways. Importance of scientific evidence. The historical examples of defunct medical practices highlight the importance of relying on scientific evidence in medical decision-making. Evidence-based practices help ensure that treatments are effective and safe and prevent the use of harmful or ineffective treatments. The power of beliefs and biases. The persistence of certain medical practices, despite the lack of evidence for their efficacy, demonstrates the power of beliefs and biases in shaping our understanding of health and medicine. It's important to be aware of our own biases and to critically evaluate the evidence for treatments before accepting or rejecting them. The impact of culture and societal norms. The social and cultural factors that have influenced the popularity and acceptability of certain medical practices in the past illustrate the impact of cultural and societal norms on medical decision-making. It's important to be mindful of these factors and to approach medical treatments from a culturally sensitive and inclusive perspective. The value of ethics in medicine. The examples of unethical medical practices, such as experiments on human subjects without their consent, demonstrate the importance of ethics in medical decision-making. Ensuring that medical practices are ethical and respectful of patients' rights is essential to maintaining the trust and confidence of patients and the public in the medical community. In conclusion, the history of defunct medical practices provides valuable lessons for psychology and the benevolent community, including the importance of relying on scientific evidence, the power of beliefs and biases, the impact of cultural and societal norms, and the importance of ethics in medical decision-making.